Right, we're live. Okay, just want to give a very quick introduction to our speakers today. Many of you will recognize them, and I will declare unashamedly that I am very biased. I'm going to introduce these two fantastic therapists who happen to be my colleagues here at Bobath, Scotland in Glasgow. Leen, or Dr. Leen van Gestel, is a physiotherapist by profession and has been with us since about 2017. And she has previously done her PhD looking at specifically at the brain lesions and the connection between that and strength, tone and movement in people with cerebral palsy. Petra is one of the other OTs at the centre, and she'd previously worked, I guess, with lots of premature babies. She worked with adults and children previously in the Czech Republic and has now joined our team in, I think it was 2013, you came, Petra. Both of them bring lots of knowledge and experience and a lot of passion to this area. And so today they're going to share some practical things that people may want to consider. And so without much further ado, I'm going to hand over, and I think it'll be Leen that's going to take us through the presentation first. So Leen, if you could just make sure you're unmuted, and you can take it from here.
Great. Thank you, Sandra, for the lovely introduction. I think we can move to the second slide, Petra, because I think Sandra's covered that first bit. So the driver for our talk today has been the fact that over lockdown, we've seen an influx of adults with CP with very similar symptoms or reasons why they were referring themselves to our centre. And most of them, if not all, came to us and reported a big reduction in activity, which kind of goes hand in hand with a reduction in variety of movements, and then again a variety of postures assumed over 24 hours. And the symptoms they reported were very often pain, and it was usually back pain, neck pain, shoulder pain, hip pain, with stiffness and reduced joint mobility, which of course has a knock-on effect on skills and functioning. We had people coming to us because they said they were struggling to be able to do their work, sit there at their desk all day, not in the office, but the home office, because they had such a sore neck or back. Other people came to us because they were not able to go into the standing frames anymore because they were in so much pain in their legs, pain in their knees, hips, or they were unable to go into their standing frame because there was no more carers coming into their house, helping them to transfer from one piece of equipment into the next. So that's why today we wanted to give you a bit of a talk, and we can go to the next slide, Petra. I'm sorry, I'm guiding my colleague through the PowerPoint presentation because she's in charge of it today. So if anything goes wrong, it's all on Petra. So today we wanted to talk about what can you do yourself at home under COVID circumstances, but hopefully it's looking better now, and hopefully that's going to be the case. But even if it's lots of restrictions, lots of guidelines, it's things that you should be able to do for yourself at home. So today we'll be talking about
I'm on the webinar.
Postural care. I think some people are still not unmuted.
Well, I'll ring him later.
Sandra, can you unmute? Yeah, thank you. Thank you very much. So we'll be talking about postural care, and there's already been a talk today delivered through PAMIS and associates on postural care and the importance of this. And we want to stress again, it is very much 24/7 approach. So you're looking at a whole day and night, and you analyze at how are you sitting, how are you positioned in your bed, how are you sitting in your wheelchair or at your office desk, how are you standing. And from our point of view, we're also interested in how do you move. And then once it's night, okay, you're positioned in your bed, but what happens throughout the night? Do you toss and turn, or do you kind of stay in the same position all night long? So we'll not be giving you a comprehensive talk through postural care from A to Z, nor will we give you an extensive list of activities. What we'll be doing today is kind of talking you through activities and advice, suggestions, recommendations that we found ourselves giving over and over again through the last 18, 19 months. So it's a bit of different things, and feel free to ask any questions throughout or at the end, and to get in touch with ourselves for more information, of course. Okay, Petra, next slide. So the first thing we'll have a very quick discussion about is sitting when you're sitting in a wheelchair. So I think something that we'll always say is look at where your bottom is in your wheelchair. Most often it will have come forwards, it will have slid forwards. So be aware of where your bottom is in your wheelchair and try to reposition yourself frequently. If you can't do that yourself, ask your carer to help you and bring your bottom all the way back so that it's flush with the back support. And then when we see people come in with the wheelchairs that you can see on the slide there, it's often a backrest. It's not providing a firm support. But if you lift up the flap, there's actually some straps in the back there, Velcro straps, that you regularly need to check and make sure they're as tight as possible, or as tight as you need, as firm to provide you as firm a support as you need, of course. Then looking at the depth of your seat, when you look at the cushion of your wheelchair, look at it and make sure that there is a little bit of space between the back of your knee and the cushion of your seat, so about 1 inch, but not too much a gap or not a gap at all. So you need to give yourself a little bit of leeway there. Okay, next slide, Petra. Then what we often see with people sitting in a wheelchair, you end up in this very rounded posture, which we call kyphotic or slouched posture. And an easy trick that you can try or look at is, if you've got a tray on your wheelchair, is to see if you can angle the tray up so that when you bring your arms onto the tray and you weight bear through your arms, that upwards angle of the tray will help you to maintain a bit more of an upright posture. So it's an easy trick that you can try. If you don't have a tray on your wheelchair, you can just go and sit at a table and give yourself a cushion that you can prop yourself onto, or anything similar. We often see some asymmetries, by which we mean you often see a bit of a sideways lean, and most people will notice it by the shoulders being not level. But if you look further down, it's often already happening at the pelvis. So you can see that the pelvis is moved over in that one, in the picture on the slide, it's moved over to the right. So actually the weight of the person is over that right sitting bone, not over the left, or not as much over the left. So try to even that pelvis out, because you can see from that pelvis, you get a buildup of that spine in a curved position, in a C curve, or sometimes even an S curve. So try to go back to the basis of where you're sitting on, and lift your bottom up with or without help and try to get that leveled out again. Your carer can easily place her or his hands over your pelvis, and as you lift your bottom, bring that in a level, symmetrical position again. Now, with that being uneven in the frontal plane is what we refer to, you often see an asymmetry happening in a different plane where you get some rotation going, and you can see that in shoulders, one shoulder being in front of the other. But you can also see it in the knees, in the legs. So you can see in the picture there that the right knee is further forward compared to the left. And you can see that in this case, it's to do with the pelvis being rotated forwards or shifted, slid forwards on the right. So again, with your carer, you can look at repositioning your bottom so that your pelvis is not forwards on one side, but level. Now, be aware that it's not always because of a rotated pelvis that you can see a difference in the knees. You can have a true leg length discrepancies, what they would call it, with some difference in length in your thigh bone, or it could also have to do with things happening at your hips. So check out what the pelvis does for you. If there's still an inequality and you're not sure where it's coming from, then it might be a good thing to try and talk to your local therapist about it and see where it's coming from, see if they can help you in any way. Then there's another thing about foot plates. They're there for a reason. So we're always encouraging people to use them and to make sure that you've got your foot in full contact with the foot plate, or as full as possible. So not just toes, not just heels or the outside or the inside borders of your foot. You should be able to have your foot fully supported by a foot plate so that you can use the lowest part of your legs to help support yourself in sitting and help you with your balance in sitting. Therefore, we also try to point out that you want your foot plates kind of under your feet, that are under your knees. So foot plates that are too far forward or too far back, you can't use as efficiently at all. It's in general, this is for like an average person, of course. So individually or in specific cases, there might be exceptions to this. Right, And next slide. This one's an important one, I think, because we're always talking about try to get yourself as upright and as in the middle and as aligned as possible, which are all big, fancy words. But it's not realistic to think that it's that you can be sitting in the middle and upright for the whole day. So it's important to schedule in breaks where you, for example, in this case, gentlemen, you can see sitting in the picture on the left, that's how he came into the session. And during the session, as you can see on the right, we showed him how he could tilt back his wheelchair and then use cushions, for example, behind his neck, behind his shoulders, underneath his arms, so that he was fully supported and he could kind of relax back into it. You can also, or very importantly, swap between your pieces of equipment throughout the day. So don't spend the whole day in one piece of equipment. Don't spend the whole day in your one type of wheelchair, but swap between your wheelchair, a comfy chair, a standing frame, a bed, a sofa, whatever you've got at home that you can position or transfer yourself into. And then importantly is alternate between active and passive time or supported time. It ties in a little bit with the first bullet point there about scheduling break time, but, and that's a big one for us, being in your standing frame, often people take that as a passive stretch time, but actually that standing frame is giving you a brilliant position from where you can do all kinds of activities. It's helping you to stay in a nicely aligned in the middle position, and from there on you can start doing really nice activity. Okay, next one. So let's go on and talk about more specific symptoms that people came or referred themselves to the center for as lower back pain. Important if you look at lower back pain is, first of all, check how you're sitting in your wheelchair or at your desk, in your office chair, and you'll often see at the pelvis that your pelvis is tilted forward, so like the picture on the left, and you can see from there the spine builds up into kind of like curve in a C curve, and you're curving backward the way. On the right side, you've got the gentleman who's sitting with a very slouched, rounded back, and the pelvis at the bottom is tilted back the way, so that's a posterior tilt. And based on that, we'll recommend you slightly different activities that you can do at home. And that's in the next slide. We'll talk about that a little bit more. So there's a gentleman sitting on the bed in the session, just at the start of the session. And you can see his pelvis is tilted back the way. So you can see some rounding at the bottom there. And if you see how his spine builds up from there, you can see that curve kind of continues up to the shoulders. Shoulders are a bit up and forward. And his head is forward, his neck is forward, and his chin is poking out. So what we worked on during the session is becoming aware of where his pelvis was in space, working on tilting that pelvis forward, bringing shoulders back and down, and then bringing that head back. So you've got a better straight posture in your spine. Next slides will give some more detail of that. So if you're looking at trying to improve the position of your pelvis, so where your bottom is in space, this gentleman had a pelvis that was tilted back the way, so was rounded. So we asked him to bring it forward. So this is him sitting in the session. He's working on this posture. It's hard work. He's having to focus on it. And he's got his hips and his knees in a 90-degree angle. So really nice sitting. But if you think about him having to sit and work at a desk all day, this is not something that he can maintain all day. So there are ways that you can help yourself remain in a better position. So in this case, where the pelvis was tilted back the way, so where it was rounded out, you could bring your chair or your wheelchair foot plates, whatever you play with, a bit higher so that your knees are slightly lower than your hip. And that will help you keep that pelvis tilted a bit further forwards. If in your case, your pelvis is tilted forwards, so you've got a bit of like an arch in your back, then it's better to actually bring those knees higher up so that your knees are higher than your pelvis, and that will help you keep that pelvis back better. Then when you're sitting, it's important, and I've already spoken about the foot, your feet being supported. But when you've worked so hard to try and bring your shoulders back and down, make sure that you've got a nice support for your forearms, either on the armrests of your chair or wheelchair or on the desk, that you're working at. And then the most important thing of all, and we've touched on that with the wheelchairs, with the wheelchair discussion a bit there just before this, is that you regularly change your posture in the chair, but then also regularly change the chair. So when you're working behind a desk, change between an office chair, maybe a big gym ball, if they let you. Might be easier when you're working from home. If they don't let you use a big gym ball at work, try some of these swivel cushions so they look like a big disc, and you can inflate them a little bit, and that will give you a little bit of instability almost, but it means you're always moving a little bit and you're not going to get very stiff, and you're not going to stay in a very asymmetric position for too long. But also use some of these standing desks and work up in standing for a while before changing your position again. Right, next one. That's the one that's kind of going a bit deeper into that correction at the neck. So it's hard to explain. You've got a head that's kind of moved forwards, a chin that's poking out, and you want to bring your chin back. But as you can see in the left picture, the lady's kind of taking it a step too far, and she's all the way back, and she's got a bit like a double chin almost. So this one is closing the angle between chin and neck a bit too much. It's better to kind of find the middle, and you can see that in the right picture where this lady's poking her chin forwards, shoulders around it, and then she brings her head back where you can see the chin's brought back and the neck is kind of elongated, it's made very long. And if she pushes it further forward, and you see she starts leaning back in that picture, you get kind of like an angling in the ear going on, and the chin is too far down. And if you try it yourself, it's even hard to swallow when you've got your head here. So that's where you want to stay away with. As it's whole of kind of an illustration that it's tricky to do it fully correctly. So it is good to, if you experience any issues there, to speak to your local therapist and work together with them. But it's to give you a bit of an idea of what we're talking about when we're talking about don't poke your chin out too much, don't too much of that protrusion. Next one. We're on to anterior pelvic tilts as a cause for lower back pain, and then I'm gonna pass you over to Petra, who's gonna talk you through.
Thank you. So I'm gonna speak now about activities that are beneficial for anterior pelvis tilt, where your lower back is quite arched. So the anterior pelvic tilt, obviously the pain can be located in the lower back, or you can have pain across both left and right side, and the pain might progress sometimes into your leg or both legs, which might be a sign of a disc problem, where the disc, as you can see on the picture here, is compressed by the vertebrae, and from the disc are coming all the important nerves to our lower limbs, and these nerves might be compressed. So if you have a pain that is shooting down to your leg or both legs, it's always good to check it with your local GP and possibly be referred to a specialist. So the activities that we'll be showing you are activities that can be done on the floor or on a bed in the morning. And the second activity we called is turtle position. So I'll go straight into the first one. So here you can see Kirsty, who is a young lady who's been coming to Bobath for a long time. And you can see she's quite arched in her lower back. So she's very stiff in her lower back, actually. And this activity helps her to lengthen the lower back and bring it down onto the floor. So by lifting the legs up, she also engages her abdominal muscles, and she can just try to bring her head towards her knees and bring the knees as tightly as possible onto her chest. This second activity, this is moving the legs from side to side. In this activity, it's very important to stay in control and not to let the legs fall onto the floor, because then there would be sudden and too much twist in a trunk. And actually, as you can see here, the arm has tendency to follow the rotation and the legs. So the advice I gave Kirsty, try to keep your arm on the floor and your shoulder as well, which means that she is able then to move the legs a bit from side to side, but it's much more beneficial for her because she is in more control of the movement itself and the true rotation that is happening in her trunk. She can gain more from it. This activity helps to dissociate, separate one leg from another, and stretch all the muscles or some of the muscles in the hip area and the legs. So the aim of this activity is to bring the leg that is straight down as much as possible. So you can see I asked Christina, like, can you relax? So actually when she put the head down, also the leg went lower. So it's always important when doing these activities to do it slowly and stay aware of your body and breathe through it. Then I'm helping Kirsty to push the straight leg even lower down, which can be sometimes a bit painful because we are stretching and lengthening the muscles. So if you as a person who's doing these activities or these activities, if you're going to ask somebody to help you, it's always important to agree way of communicating, how you're gonna say that you are in pain or uncomfortable and you want the person to stop pushing or pulling or whatever they are doing. Sometimes, even if you are able to speak verbally, you might be in such a strange position that you might not be able actually to say it quickly enough. So there might be different ways how to communicate that you are not comfortable. And what we often do is we observe a person's facial expression. So that's the first sign where we see that something is not right. And also as a person who is helping, I'm observing how the client is breathing, and also need to be aware of the changes in a muscle tone, because obviously if the person is sore, then the muscle tone will increase.
Right, and we're gonna talk a little bit through this. So this is the same activity on the bed, but for a person who finds it harder to do these things himself, so would need some help of a carer or family member who's there. So the top picture shows you how we've positioned this gentleman on the bed with a cushion underneath his head and his shoulders, which helps bring them forward already and stay away from that curved back the way position. Now we've positioned his legs over a big gym ball. We used a rolled up towel to position around the gym ball so that the gym ball doesn't just roll away, but it stays in place. If you find that the legs slide over the gym ball from the side, you can also use some sort of scarf that you wrap around, not too tightly, of course, but that you wrap around loosely the legs, so it's just to keep them together and on the ball. In this position, you can just use gravity and let gravity help you to bring that lower back down and into a more straight or curved out the way position. So that's a more passive approach. If a person that your position like this is very happy and relaxed in this position, then that's great. You could also do it more actively. So in the bottom picture on the left, you can see I am using the gym ball to move the person's legs from left to right. So you're doing small movements first and start very gently. And then based on what the person is feeding back to you, how it feels, you can go for bigger ranges of movement, a bit faster, a bit slower, see how the person responds to it. If you want to take it to the next step, then you can ask the person to help bring his legs back to the middle. So you can bring them out to the left, for example, and then tell the person to bring his legs so that they're back in the middle again. And then you do the same for the other side. Another way is that you actually ask, and that's the hardest one, of course, that you ask the person with his legs on the ball to move his legs over to the right, bring them back to the middle, and then back to the left again and up to the middle. So it's all grading that you can integrate into this activity. Petra, back to you.
So this one we call turtle position. The aim of this activity is to lengthen the lower back again and bring the bottom all the way down onto heels. So the arms can be placed forward, so that also kind of lengthens the area between the arm and the trunk. Again, then I can help Kirsty to gently push her pelvis down and rock maybe from side to side. In this situation, obviously, when we talked about recognizing that somebody's in pain, I can see Kirsty's face. So if you're doing it or helping somebody, start very slowly and build up this activity, because you need to get to know the person limits. This is another variation of it where the arms can be along the body and the head can rest on a pillow if the head can reach all the way down. This is another area, and that is trunk, pelvis, hips, and lower limbs mobility. So what we often see in our clients is reduced trunk mobility that often leads into reduced hip mobility, and that might actually increase the tightness in lower limbs. So the activities we're going to be showing you is side sitting and transition between the two sides. The next one is walking on your bottom, then stretching back of legs and hip, pelvis, and trunk mobility. So side sitting is a really good position, and also if the person is able to get into that position, it's even better. Side sitting requires lots of dissociation, and dissociation is a movement of one segment from another. So here, obviously, one segment we can call pelvis. The next segment can be the middle part of the trunk, and the top segment can be the upper body. And you can see that in side sitting, all these segments need to do something different. So I asked Kirsty to bring the lower leg a bit closer. And here you can see she's transitioning onto the right side, and she's using the arm to prop because it's too tricky to do it without it. And you can see that at the moment she's kind of staying kind of all the body parts are facing, let's say, forward. But when I ask her to do it without support or help from her hand, then you can see how much the body needs to twist. So her knees and pelvis is pointing to the right, then the middle part is slightly rotated and the top part is pointing to the left. So in this activity, there's a big involvement of the abdominal muscles, and it improves the mobility of the trunk as well. So this one is walking on your bottom, where this activity requires weight shift from side to side and be in control of the weight shift. And this is really good to practice because you might use it, you can use it in, for example, adjusting your position in the wheelchair or on your chair. And moving forward might be a bit easier because you can see Kirsty slightly using help from her feet, from her heels. When I ask her to do it the other way around, it's much harder for her. And you can see that the weight shift is even greater. She's moving from side to side, but really good core involvement and effort from her, even though it's much kind of slower movement for her. What is also important with these activities is to make sure that you have nothing around you, because you might lose control and fall suddenly to the side or backwards. So you don't want to hurt yourself. So this one, the stretching back of the legs, this is kind of classic kind of a position where the hamstring are stretched. It can be done in lying on the floor. It can be done in long sitting. It can be done in standing. You know, you can use a table or you can try and reach the floor with your hands. And this one we call hip pelvis kind of trunk mobility. In general, to lie on your stomach is really good to lengthen the muscles in the front of your hips, which are often shortened if we sit for long periods of time. So the aim of this activity is to bring the knee up as high as possible, because there is a bit lack of abduction in the hip area. You can see that the whole body kind of rolled a bit sideways, and also the shoulder on the side of the knee that is bent is kind of quite far away from the floor. So when Kirsty does this activity on the other side, in a little while I ask her to turn her head to the opposite side, because you can see here how far the left shoulder is away from the floor. And if she will turn the head onto the other side, then the shoulder will move down, and that will increase the rotation in trunk and the twist. And if you're doing such an activity, you need to be quite cautious and careful, because for a person who can suddenly go into spasm, it might be really difficult position. You can see the shoulder went a bit lower, so there is quite a significant twist in her trunk. So if you can go suddenly in a spasm, it might be quite difficult to quickly get out of this position. So when you're doing such things, then do it slowly and carefully, and get to know your body and your own limits. Okay.
I'll just mention a couple of things about how to do this when you are not able to do it all yourself, but you need much more input from a carer. So as you can see in the top picture, we started off with this gentleman on his body. He was able to roll himself from his back onto his body, no problem. We've positioned a rolled up towel underneath his feet. I just want to point that out as well, because he didn't have the mobility in his feet to kind of relax them fully down on the bed. But if you kind of give them a little bit of a surface to relax into, it means they can assume a more relaxed and stretched out position in the end. So from that position, we helped him to kind of move his right leg up and asked him to maintain his position for a while over time with relaxing into the position. You saw that he could move his legs out a bit further and his spine evened out a bit more. Importantly, if you're helping someone to do this, is that you kind of stay away from pushing that leg up so high or so far that the person is kind of almost on his side. So you want to stay in between the lying fully flat on your tummy and lying on your side, so that you'll move in between lying on your tummy and going over onto your side a little bit, but just avoid being completely on your side, because then you're kind of losing out on all the stretching and twisting that we're aiming for at this point. And in the bottom right corner, you can see we're also able to bring out the person onto the other side who's struggling a bit more with that, but over time, with being positioned in that position for a while, again, he was able to achieve a bigger range. And we then used that later on in activities where he, like standing, stepping, walking, where he could benefit from the increased range. Right, back to you, Petra.
So the next set of activities are aimed for the upper body strategies. So the common issues is tightness and reduced mobility in shoulders, neck pain, and also partially can be restricted breathing. So often people who use walking aid might overstrain their arms and shoulders, and also people who help with transfers might often use more their upper body than their lower limbs. So the activities, we call the first one Hello Sun, then the second one is roll forward using a gym ball, and then shoulders up and down. So the first one, Hello Sun, is the reason is because it looks like sunbathing a little bit. So here Kirsty is asked to lean backwards and turn her arms out as much as she can. And here I'm correcting her posture, and you can see what happened in her lower back. What she did, she corrected her posture by arching her lower back quite a lot. And we know that this is one of her difficulties, that she has too much the anterior pelvis tilt, too much arching. So we brought bench under her feet. So again, the curve kind of is corrected. And I positioned her arms a bit more out, so her fingers are pointing more sideways or backwards. So in this position, you can see that the chest is much more open, and she is just asked to stay in the position and take a long, deep breaths and be aware of her body, and let the breathing, the deep breathing, actually do the work as well.
Again, how to do this when you need a bit more help. This lady is actually, she's in a different starting position than Kirsty altogether. As you can see in the bottom, her pelvis is tilted back the way and she's more in a rounded position. And one of my colleagues, Philippe, is helping her there to open up more, bring her arms open and out to the side. So they kind of build it up gradually. You can see in the left, Philippe's helping bring her arms out, and gradually she opens up more. She's able to lift her head and bring her arms back and out to the side. In the next slide, you'll see that she's able to bring her arms down onto yoga blocks, because all the way down onto the bed was still a bit too much, but gradually she's able to even bring her shoulders further back, bring her chest bone a bit up and out, lift her head, and look at that last picture where she's brilliantly sitting, arms behind her, head up in the middle, and almost looking happy into the camera. Yeah. That's still me, almost forgot. There's another way something that you can do, and which is also a good activity, is to just try and use a surface that's in front of you. So bring your arms forward and position your arms onto the surface and start using active weight bearing through your forearms to try and push up and bring those shoulders back and down, and lift that chest bone up and forwards out. And you can see on the left, the same lady as before. On the right is the gentleman that we saw at the start of the presentation, both very, very different starting positions, but able to use that same activity where you're trying to bring those shoulders back and down and lift the head up and bring it in the middle. Yeah.
Okay, so this one is called roll forward using a gym ball, which just describes the activity itself. Kirsty is asked to place her arms onto a gym ball. The aim is again to correct the upper body, in her case, not to arch her lower back, because that is already quite arched, and also lengthen a bit the area between her arm and her upper trunk. So I'm helping to kind of bring her arms a bit further. And then I ask her to move back and forward, again, all by herself. The reason why the ball is on a chair is that we didn't want the ball to move any further, because that would increase the curve in her lower back, which we don't want.
And then you've got a good example here where it's done differently. So this is a gentleman from the very, very start of the presentation. He has got a pelvis that is by default pushed back the way. So he's just on a low bench, and I've asked him to open his legs a little bit further out. The ball's on the bed in front of him, but there's no stop to it. So I mean, there's no back of a chair that stops the ball from moving, because he can go quite far, because I want him to come forward and I want him to come out of that backwards posterior tilt of the pelvis. So his arms are over on the ball, he's moving forward, he's getting a good stretch, and then he's moving the ball over to the left to stretch out the side of his trunk. So he's stretching out the right side in that middle picture, and then he moved the ball the other way to stretch out the left side. And if you've got a carer around or a family member that could help you do something similar to the bottom right picture there, it's just deepening that stretch a little bit further, where he could get a further stretch on those upper arms. And and the shoulder blades. Now, be very careful, because I'm not pushing on his shoulder blades. I've kind of got my hands right next to his spine, and what I'm doing is just pushing slightly forwards and down, just to deepen that stretch and to get a further straightening of that upper trunk that we're aiming for.
Okay, and this one is the last activity that we would like to show you, and that's activity that helps to bring more awareness to the shoulder gilder area. And the aim is to improve the ability to bring the shoulders down and slightly backwards. So we started with Kirsty moving her shoulders slightly up, because the whole area is actually quite stiff. So we don't want the shoulders to move too far up, because that might be, for many people, the easy part, but we want the shoulders to go down and back as much as possible. So again, sometimes in this activity might be good to use mirror, so you can see yourself what you're doing, or ask another person for help to with the movement. And in general, when doing all these activities, is always the most important part is to breathe through it, not to hold your breath, and stay aware of your body and what your body is telling you. Thank you.
Great, thank you, Petra and Leen. Just in the nick of time, I have to say. I was beginning to worry that you were going to get cut out of the room any moment there. Sorry, folks, we're not going to have time, I don't think, for many questions for this session, but I think what, as a team, we probably would want to just reiterate to people is just to be aware of the differences, between, the girls spoke about different kinds of presentation, and if you're not sure which of these presentations you fall into, that you would definitely be best speaking to your physio or your occupational therapist to get some specific advice. The girls have given you a flavour of some of the things that they found helpful for some of the adults that they've been working with, but we are very much aware that everybody is different, and so you must take care and make sure that you're doing what's just right for you. I think what it did demonstrate in trying to tie it in with the other talks that we've heard today is very much that the importance of, while we want to work at very much participation level and enabling people to be far more active in their daily lives, to be able to do the things that they want to do and what are important to them, that sometimes when pain and discomfort get in the way, we need to work through these things first before we get to maybe higher level goals. And certainly that's what we felt as a team through the pandemic, and people were very much having to look at these more impairment level issues that they were experiencing before they were able to push on to other goals. So I hope you found this session really helpful. I don't know if anybody, and we might have time for one question. I'm kind of nervous to open it up in case somebody gets cut off, but I mean, maybe a better way of doing it is that if anybody has specific questions, we're all based at the centre here in Glasgow, and feel free to email us. Maybe that would be the best way, rather than somebody asking a question and then not getting the full answer that they really want. So I just want to say thank you to Petra and Leen for their time today, and for pulling together some of the specific cases, because I think that always makes it more interesting when you can see real people and it's not so theoretical. And just want to say thank you to all the adults who were so willing to give their consent to be used as models for these pictures. So thanks very much, folks. You can leave this breakout room now, and then we'll rejoin the rest in the main room. Thank you.